every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Good morning, good morning, good morning, and welcome to another episode of Health Vibes. It is a beautiful Wednesday morning in the Commonwealth of Dominica, and we're so happy to be able to join you for another Wednesday where we always talk about health and make it have some vibes. Today will be no different. We have special guests in studio, so we will be having a very interesting discussion this morning. So, as I always say to our listeners, our faithful listeners here on the big station Q95, if you have a friend, tell a friend to tune in because Health Vibes is on, and you're always gonna get some interesting information, interesting discussion. So you need to share the word that Health Vibes is on and people need to tune in. If you are home and you want to log on to Facebook, of course, we are live on the Facebook page of Q95. So if you want to get a visual and you want to know already who we have in studio before I announce, you can always check us out on our Facebook page. This morning, I am with you. This is Trudy Christian. Mr. Carlton Langdo, the chief host, will be joining us shortly. He's on his way, but he'll be joining us. So don't fear. Mr. Langdo is on his way. All right. I want to also say good morning to Jacinta Fagan Defo. That is our other Health Vibes resident host. She's not with us this morning. She might be coming on next week when I am not on. So we kind of rotate. Okay. So Jacinta, good morning to you, wherever you may be this morning, maybe busy in the dispensary at Jolly's pharmacy. Good morning to you. This morning, before we actually go into our planned topic, which, as I said, is going to be interesting, it's going to be vibesy, I wanted to, alert our listeners. Of course, this is Health Vibes, and we always talk about health. And recently, there have been quite a few cases that I have observed of dengue fever. Some people might not be aware of dengue fever. It's something that's endemic to Dominica, meaning we always have cases of dengue, but they occur in small numbers. But sometimes you notice a little uptick, and I have observed recently that quite a few people, have been affected by dengue fever. So I just wanted to this morning take the opportunity to let people know to be on the alert, try to protect yourselves from the bite of the vector of dengue fever, which is the mosquito, the Aedes aegypti mosquito. So now is the time to really be aware about your, I would say your mosquito ready defense. So make sure you're using your repellent. Make sure you are covering your skin. If you're going out, you're wearing these clothes that can allow you to be not bitten. Make sure you are, if you have a mosquito net, you maybe sleep under the mosquito net. Just kind of take precaution. So the symptoms of dengue, and as I said, I've been noticing, a few people, coworkers even, who have had dengue in the recent past. High fever, body pain, a lot of joint pain, and dengue fever, especially if it's maybe the second time you've had dengue. Dengue fever is also associated with hemorrhage. It's actually called dengue hemorrhagic fever. So some people also experience some internal hemorrhage, bleeding, if they have dengue fever. So it's not something to joke around with or play around with. So please be on the alert. I wanted to put that out there as somebody who is always kind of trying to monitor our infectious disease patterns here. Please be on the alert for dengue fever. If you know mosquitoes like you, normally try to make sure that you're preventing yourself from getting bitten, particularly in this time. All right. So be on the alert, be on the alert, be on the alert. It is now 10:24 a.m. As I said, we have two guests in studio. We're going to be discussing something related to health as usual. And there's a very important day coming up on December 1st. It's going to be World AIDS Day. So our guest in studio will be discussing something relating to that. So I'm giving you a hint. So I'm going to take a quick break. When we get back, we're going to delve into the topic that we have this morning, and I'm going to introduce to you our guests in studio. So we will be right back.
Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
And we are back with you on Health Vibes. This morning, I have two ladies with me in studio, and they are from the HIV/AIDS Prevention Unit. And I'm going to allow them to introduce themselves. But I have with me Miss Glenville, and I have with me Miss Boye from the HIV/AIDS Prevention Unit. And as I mentioned before we went on the break, December the 1st, that's Friday, is World AIDS Day, and that is observed worldwide. And of course, Dominica is no different. So World AIDS Day is really a time where we kind of focus on the AIDS epidemic, and we want to bring more awareness to that. So we have these two ladies in studio, and I will allow them to say hello and introduce themselves. And we're going to be discussing HIV/AIDS this morning. Ms. Glenville, good morning to you.
Good morning, Judy. It's a pleasure to be here. I am so happy to join you on this program. My name is Fiona Glenville. I am the health educator at the National HIV and AIDS Response Program.
Hi, good morning. My name is Clemencia, and good morning to all the listeners as well. And I am here to talk about HIV today.
Okay, so we have a health educator and Clemencia counselor.
Yes.
Okay. All right. So we have two different backgrounds, but same unit, working in the same unit. And they come into today with all the information and all the tidbits that we need to know. Oftentimes, or in recent times, I work with young people, and I get the feel when I speak to young people, particularly about reproductive health and so on, that HIV/AIDS is not even how it used to be perceived before, as a death sentence, as something that is very something people didn't even want to kind of address, or something people were very scared of. I get a different feel these days. What is the picture like really with HIV/AIDS locally, and what is the type of perception people have?
When you speak of the picture, you're looking at statistics.
Yes,
correct?
yes. So what's our local picture? Is it, are we having cases occurring frequently? What is the incidence rate like? What is going on locally in terms of HIV/AIDS?
Okay, so let me tell you. So from 1987, that was our first reported case,
Mhm.
and today we have about 558 people living with HIV. Well, 195 deaths.
Okay.
But today we have 363 people reported people living in Dominica with HIV today.
363. And
363
you made the emphasis of the word reported. I guess that you have a reason why. So tell me why you have to emphasize the word reported when you give those numbers.
Yes, we do, because we know that although these are the ones that we've tested and have identified,
Mhm.
there are others out there who have never been tested. And of these cases, we would not know how many of them there are.
Right.
So it's important to do a test to find out if you are HIV positive. You spoke earlier about the perception of HIV, and I think one of the challenges is that we've kind of reduced our visual. The way that we've looked at HIV, we're no longer seeing it as a problem, but it
Mhm.
still continues to be a public health problem.
Mhm.
Because when we take our eyes off from certain issues, they tend to escalate. And by the
Mhm.
time we notice, then it's out of control. And we do not want that to happen. So we want to keep our eyes on HIV, that it is still a public health problem. You're right, it is no longer a death sentence, because we do have the medication that we can treat HIV, and to keep the viral load, so the level of virus in your blood, to a level where it is below, it's undetectable in your blood, meaning that the risk for transmitting of HIV is reduced. However, that means that these people need to be in care. So we need to know who is infected with HIV so that they can be into care, and we can keep them on their treatment, give them the support that they need, so that we are able to reduce the risk of spreading HIV within our communities.
Mhm. And I like this whole concept and how you brought it forward, that when we don't look at it, when we're not keeping our eye on a particular problem, it can escalate. So it's we always have to be on our P's and Q's, that's what they say. Like, you have to keep,
Exactly.
yes, you have to keep looking and monitoring and being aware and doing things to make sure that the problem does not
Right.
escalate.
So one thing that I want to add, though, is that we've had at least 15 cases for the year.
Mhm.
And on a yearly basis, we have between 12 and 16 new cases of HIV. These are
Okay.
people who have never been diagnosed before,
Right.
that are now being diagnosed.
New.
So considering that we have these new infections happening, this is something that we need to try to reduce. We do not want to have new infections.
Right. So we in November. Well, we're at the end of November. You've had 15 cases thus far for the year 2023. Your average is 12 to 16. So it's possible there's one more month in the year. So it's possible you might get another case or another 2 cases and kind of even be beyond your average. So it's not something that's not a problem, because because if the numbers you're telling me, if you have to think about it, if you on average have 12 to 16, this year we've already had 15. That means we're not, we still need to be looking at this issue.
Exactly.
Yeah.
And our challenge is having people come forward to test. I mean, as a nurse, I do know that we're afraid of the needles. It's just a small prick, but it's something scary for us. But I think that knowing your status and knowing how to move forward with your life helps you to be healthier.
Mhm.
If you know that you're negative, you can make decisions to continue to be negative.
Right.
If you know that you are positive, you can make decisions that I know that I'm going to be positive for the rest of my life. However, I can remain healthy. I can live a full life. I can go to school. I can become the prime minister. I can do all of the things that I want to do.
Mhm.
Even with HIV, because it is no longer a death sentence. It doesn't mean that as soon as I find out I have HIV, that I'm going to die.
Right.
And this brings forward the distinction between having HIV and having AIDS.
Mhm.
When we speak about HIV, we're looking at the virus that infects an individual. It can be through sexual contact, it could be from mother to child, it could be through contact with bodily fluids like mucous membranes and blood.
Mhm.
It could be transmitted through needle sticks. So our health workers are sometimes at risk for these infections if they get needle sticks. Once that virus gets into your bloodstream, it starts to attack the cells that are responsible for our immunity, so for fighting off infections, for fighting off some types of conditions, even certain types of cancer. Our bodies have cells that are able to fight these off. And if it is not working properly, then these types of infections are more likely to attack us. So we would get an infection that normally we would not be able to fight off. And this is at the stage where we start saying that that person has AIDS. We call it an opportunistic infection. So persons can live with HIV for many, many years and not have any signs and symptoms and not develop AIDS. And if they are on the medication, if our patients continue to take their medication as they're supposed to, then the risk for developing AIDS is still reduced.
And that is also important, very important to understand, because you can live, if you test HIV positive, you can live without progressing to full-blown AIDS, which is where your immune system is essentially unable to fight back against these infections, opportunistic infections, as you mentioned. You can live a life without progressing to that stage, and so knowing is so important.
Exactly.
Knowing is so important. Nurse, you mentioned the ways that the virus, HIV, can be transmitted. And that always kind of, I think, gets the most discussion, because there are a lot of misconceptions about the transmission of HIV. I think people have done health education, workers and health promotion has done a lot of work to kind of guide the discussion away from, if I touch somebody with HIV, I can get it. These misconceptions. Do you still feel that people have these ideas about the transmission of HIV/AIDS, or are people very much aware now, you would say, of the ways in which the virus can be passed on from one person to another?
Well, I think we know it, but in practice, sometimes it's difficult.
Okay.
So if I ask anybody, how is HIV transmitted? Oh, you need to have sex with the person. You need to be in contact with their blood or with their body fluids. However, if I say I'm HIV positive, you see somebody start to move away. So these types of stigma are what hurts, when your family, your friends don't want to interact with you in the same way that they're accustomed to, just because they find out that you are HIV positive. So it still exists. It continues to exist, and we see it as something big. If I heard that Nurse Glenville has HIV, oh, we have to go discuss it this way, discuss it that way. And that's a fear that is built in people who are living with HIV, that people are going to treat me differently. People are going to look at me and be whispering. And then sometimes it can be self-stigma, because they themselves see that, there's something that I have that people are afraid of, and perhaps I myself am afraid of it. So if they see people talking, they may think that, they're talking about me. But we have to try to embrace people and look at them as they are.
Okay.
Look at them as people. that if I am passing by and somebody stops talking, I may think it's me, whether I have HIV or not. And if I am sitting next to somebody and they start moving away, or I borrow somebody's cup and they say, I don't want to use it anymore because I know you have HIV, it's going to hurt. So if we know that that hurts a lot, we need to try to make difference.
Right. And not just, I mean, and also preventing other people from wanting to get tested and find out their status when they see, this type of negative or this type of stigma being attached to a positive person. So I really would like to use this platform that we're here on Health Vibes, the listeners of Q95 are on, to kind of encourage, people to stop that type of practice. If there is someone who has HIV or is HIV positive, or if you've heard that, or to stop this sort of discrimination or stigmatization that we typically see. And that brings up another thing, and it's the whole privacy confidentiality issue. I want to know both of you all's experience with people coming into test. Are they afraid of the confidentiality aspect? Is it something where people are, because it's something that I have heard, people are thinking, boy, if I get tested, my business is going to be on the road. Or if I just ask for a test, people are going to say, why she asking for a test? Why she coming and test for HIV for? What she doing? So that type of attitude relating to testing, is that something that is still present, or how is it dealt with? I am very interested in that aspect of things.
Well, I can speak from our standpoint at the HIV unit, and I don't think anybody is afraid to be tested.
Okay.
Once they come up the steps, it's because they've made a decision. And
Okay.
we are so excited to test everybody. With regards to confidentiality, we don't. I do not. I can't say that we have that issue at the unit. We embrace people for who they are. We do know that some people may not have the same values that we have. They don't have the same, they think differently. And so we welcome everybody. We welcome those who are on the road and who do drugs, who are mentally ill. They're our friends. They come up and we do counseling and testing for all the clients.
Okay, and where else? So the HIV/AIDS Response Unit, which is the correct name, right?
National
HIV and AIDS Response Unit, because I called it the Prevention Unit. But anyway, the National HIV/AIDS Response Program, right? The proper term. Apart from with you all, where else is testing done? What is the availability of testing in Dominica?
Well, in Dominica, you can get tests done in how many health centers? I know it's the 7 health centers, the seven
health districts,
centers in Dominica, including us. We sometimes collaborate with Dominica Planned Parenthood to do it, and you can as well do it privately for private labs.
Okay,
but that comes at a cost.
Okay,
to the person who wants to take the test.
Okay, so is testing so if I go to a private lab, there's a cost. Yes, that is understood. If I come to you all, is it free?
Yes.
Okay, and in the public health system at the health centers, it's free as well.
It is free. And one of the things I would encourage somebody to go to a public is because when you go to do a test, you don't just go in and then have your fingers stuck and you do a test. You go through a process where you sit with a counselor and we talk about different aspects, including your sexuality and what risks you may have with regards to HIV. After this, you go to do the test. So this whole process helps you to prepare you in case you have a positive response, what's going to happen. So we explain all of that, and subsequently, after getting your results, you come back and we discuss it with you. So I think that process is very important.
Okay, so you have the pre-counseling and then the post-counseling. Okay, I see someone is already calling in. Let's take this call. Caller, good morning.
Yes, good morning. How you doing?
Good morning. Good, thanks.
Yes, yes. It's an important conversation, your topic you're talking about. But my question is, because in this world we have to try to educate individuals that think that whatever they have is a death sentence, and it's not really. You just got with information and education. Because I know an individual. I don't know if you have heard about him. And one from Dominica, and that individual used to live in Dominica and Point Michel, which is Dr. Sebi, was successful in healing individual with HIV. So I'm saying I think many people, you all should inform yourself on what he did, the regimen, and to inform those individuals. I think that they are at a depth when they have contracted HIV. And from studying him, it's very simple. It's just building up, cleansing the toxin and building up the immune system, and abstaining from a lot of dairy products, which it's a lot of mucus, congested, and break down the immune system. I think we just have to educate the people about that. We all make mistakes in life, but that doesn't mean we have to continue to live like we're gonna die. We're gonna die. We learn from those things there. So we should inform ourselves about the people that were successful in eradicating the HIV virus from one's body. Thank you.
Thank you, caller. All right. Let's comment
Yes,
on this.
I do want to comment on this. And thank you very much for that, caller. My comment would have to do with the fact that we base everything that we say on scientific evidence. So, whilst that may be true that somebody may be able to do with using whatever that the person used, there has to be some scientific evidence that we can bring forward to our public. And the scientific evidence I know is that HIV is not a death sentence because we are able to provide medication to bring the level of the virus below what can be detected in the blood. With the medication, when they are off the medication, it starts to proliferate, and what happens is that they build some level of resistance to the drug. So now we have to try something new. And whilst we are still looking for a cure and looking for ways to improve the quality of life and to improve the outcomes of care for HIV positive, we are still not at that point. We are at a point now where we are able to control the virus in the blood, and this is what we want. We want our clients to come in and get the medication so that they are able to control the virus. It is now what we call a chronic communicable disease. With medication, you are able to reduce the level in their blood. You are able to reduce the risk of spreading, meaning that you can have a partner and not spread to your partner. And this is where we want to be. One thing that he brought up is about making a mistake, and I really wanted to address that because we tend to see having HIV as being a punishment for some mistake. It is not. We do have people who have done nothing wrong in their life. They've lived a life as how the church wants them to live, and they still develop HIV. It is an unfortunate incident. It is an unfortunate event. It is not a mistake, and we do not treat people like they've done something wrong that they are being punished for. So our persons who are living with HIV, they are not criminals. They are not delinquent. They haven't been the ones who are part of society who have done wrong. Having sex with somebody is not something that is wrong. And we need to move away from looking at it as a mistake, that you've done a mistake and you need to change your life. That's why you have HIV. It is something that can happen to anybody.
Right. This I really like that, and it's something that I strongly believe too. And often when it's the perception that we give to disease or to certain conditions that really kind of affects the mental health of those suffering or those inflicted with that condition. So I've spoken about this before, and I'm so happy you are speaking about it as it relates to HIV. I've spoken about it on this program before as it relates to other diseases like cancer, for instance, like people talking about the whole, oh, the person wasn't living a healthy life, and so they got this, and then there's the guilt now that the person has to face because the person thinks, what did I do wrong, and that now complicates and worsens the medical
Exactly.
condition. Yeah. So I am so happy that this came up and that you addressed it in that way, because it's the perception that we have that often causes things to be worse, for our people who may have, may have some sort of medical condition or some sort of concern. In this case, we're talking about HIV. But trust me, people, there's a lot of guilt that we like to pass around as it relates to health, and it's really not productive.
Exactly. And
Mhm.
we at the unit are very concerned about mental health
Mhm.
and about keeping your spirits up,
Right.
because
right.
we see mental health as very important with regards to your overall health.
Right. Correct.
And so when we put in those kinds of blame and
Mhm.
those kinds of guilt trips, like you
Mhm.
say, and make it look like something shameful,
Mhm.
we are also affecting the health of the individual.
Of course. Of
And
course.
they hear us all of the time.
And we cannot wait for something drastic to happen, and then for us to then feel sorry for people and talk about mental health. It's something. I mean, that's a whole other topic, but it's
Yes.
something that really bothers me. In our society, how we kind of we do certain things, and then when something happens, and we talk about, oh, that's so sad. But there are certain ways that we need to protect each other's mental health. We need to protect our mental health. We need to be cognizant of some of the things that we do that are impactful to mental health in a negative way, and try to change that dynamic. So I'm happy this came up. It took us a little off, but we're still on the right track. There's something else that you mentioned as it relates to having a partner, being HIV positive, having a partner, being on medication, and having viral loads that are undetectable, and having a partner that cannot you cannot pass it on if your viral loads are so low. What about having children? That is another thing that people ask about. What about being HIV positive and being able to have a family? What is the consensus on that, or what is the information as it relates to that?
Okay, so you can have children if you're HIV. If you got HIV positive mother, you can definitely have children. You take a medication as prescribed, and then you end up with your healthy little babies. Well, HIV negative babies, I want to
Okay.
say, because since 2005, we've had no babies actually being born with HIV, and we've definitely had mothers giving birth
With HIV.
with HIV.
Yes.
Uh-huh.
I'm very happy you
That's a
brought
good
that up,
statistic.
because we tend to see it as, life stops. But
Mhm.
yes, we do have we call them serodiscordant couples,
Mhm.
where one part of the couple is negative and they've continued throughout their lifetime being negative.
Mhm.
And so, because of the programs that we have, we now have the PMTCT program,
Mhm.
where the mother who is HIV positive is monitored throughout her pregnancy.
Mhm.
And at the end of when she delivers, the baby and the mother continues with that monitoring. So we treat both baby and mother for a period of time. We give advice, we give support, because support is so very important to keep them negative. And so, like she said, from 2005, it is a tremendous achievement
Oh,
for
yes.
Dominica that we've managed to be validated as having eliminated mother to child transmission of HIV.
Mhm.
And that is just excellent, and we're very proud of that.
Yeah, that's major. So, having that on record, and from 2005, so we're talking almost 20 years. Yeah, almost 20 years, 18 years of having zero mothers passing on HIV to their baby. And I mean, that is tremendous, because we do know that that is one way that HIV can be transmitted, mother to child. And we've managed to eliminate that way in Dominica for that long. So that is definitely good news, and it's definitely encouraging for somebody who maybe has gotten a HIV positive result and is still of reproductive age, and maybe has been thinking that means that I cannot have a child, and this information can be so encouraging to that individual dealing with that diagnosis. I wanted to talk a little bit about getting a positive diagnosis. You mentioned earlier, nurse, that there's pre-counseling. You before you do your test, pre-counseling, you do your test, and then when you come in for your results, post-test counseling. If somebody has a positive result, they go through that counseling when they get their result. What's next for that person?
Okay, so there's a referral system.
Mm-hmm.
So they will be referred to the National HIV and AIDS Response Unit. And the next step is to get linked into care. So
Okay.
we do have the medical doctor who is able to review that case and identify what are some of the challenges, get that person on medication. And also the social aspect of it, we would look at what are some of their challenges that we can help with, and with their mental health also support. So this is why we have counselors at the unit, for example, with Clemencia, to talk to people about what is it that is bothering me with regards to that diagnosis, because we understand that it can be challenging to have a diagnosis like that. So the support that we give is very fundamental, and it is something that we continue throughout their lifetime. All clients can call us at any time and have that discussion with us.
Okay. And if somebody is HIV positive, what is the advice, or what then happens to the person's partner or partners that they may have encountered? Is there contact tracing that is done, or does there need to be disclosure? What are the policies relating to that?
Well, there's definitely contact tracing.
Okay.
Because we do know that with one case, you need to find out how many other cases are there and get these cases into treatment.
Okay.
So definitely we have contact tracing. With regards to disclosure is the right of the individual to disclose if they want to. We do guide. So if there's a situation where they need our support with disclosure, we give that support. But it still is the right of the individual to disclose whether they are HIV positive or not.
Okay, so disclosure is the right of the patient, and but contact tracing is done to determine, if there are any other cases linked to that patient, and to get those people possibly into care. Okay. All right. Let me just give the numbers really quickly. We have a few more minutes with our guests in studio. We have with us Ms. Glenville and Clemencia Boye from the National HIV/AIDS Response Program. I said it right. All right. Our numbers are 449-3095, 449-3096, 449-3097, and 616-4257. Of course, if you're calling us from overseas, you can reach us on 305-432-9624. So, ladies, we've been having this discussion on HIV, how testing, how it's dealt with, treatment even. I want to know, for World AIDS Day, what is planned, or what is in the books for you all at the response program?
So for World AIDS Day, which is on Friday, we are encouraging the public to be tested. So what we're doing is partnering with different groups to help increase the number of persons who are tested, and we're looking for new persons
who've never been
tested before, and the ones who are afraid to be tested. You can come to the HIV unit on Friday. That's at the back of Whitchurch, and just walk up the steps and come and get a test done. And we are encouraging the communities to lead in that process.
Okay.
So if you can organize different groups and come together, show
Nice.
support to each other, we welcome that.
Mm-hmm. And I think that really kind of maybe eases up some of the anxiety of people if they can come together
Exactly.
in a group. So you've heard it right here on our program that on Friday, you can come. You can go to the National HIV/AIDS Response Program. The office is behind Whitchurch, and you can get tested. And you can come with a friend. You can come with a little group. You can come and take that opportunity to know your status. Yes. Right. So I do hope that people do take the opportunity to do that. Friday is World AIDS Day.
Yeah. Right. And you get your results within 15 minutes of doing the test.
Okay. So it's the rapid test.
Yes, it's a rapid test.
Okay.
And the other thing is that nobody else knows your results.
Okay.
Except if you want to share.
Mm-hmm.
We do not disclose to anybody. It's everything regarding your situation is private.
Okay. So definitely take that opportunity. Confidentiality is ensured, your privacy is ensured, and it is an opportunity to really get to know. It's something that, as Nurse mentioned, it's important to know, to help you to make decisions moving forward. If you're negative, to stay negative. If you're positive, how to make sure that you live a healthy life, and don't progress to full AIDS. Yeah. So
Right.
yeah. So it's definitely a good opportunity. I would like to encourage everyone to take that opportunity, especially if you have not been tested before.
Exactly.
Uh-huh.
Another thing, Judy, is that at the St. Joseph Health Center, you also have testing done.
Okay.
So if those who are from St. Joseph can go to the health center to have the test done.
In St. Joseph.
In St. Joseph on Friday.
Okay. All right. So ladies, I know you didn't have the entire time to stay with us on the program this morning. I don't know if there are any final words from the two of you that you'd like to share with our listeners. I see we do have a call though. Let's take this call and then I'll give you that chance right after we take this call. Caller, good morning.
Hi, good morning. I have a question.
Okay.
One of the statements the nurse made, she said that disclosure is all up to the patient that was diagnosed. My question is, how is contact tracing done without disclosing the person of origin? That's my question.
Okay. Thank you, caller.
That's an excellent question.
Yes, that's a good question.
Yes, it is. But the nurses and the staff who do contact tracing are excellent at their job, to be honest.
Okay.
And we have been doing contact tracing since 1987, when the first case was discovered. And it has been a private and confidential process. So we do get the names of the contacts. And they have their ways. I don't do contact tracing, so I really can't explain the process.
Okay.
But they do have their ways of finding out and testing the contacts.
Okay.
One of the things, if there's only one contact that you have had, you may know that yes, that might be one of the reasons, but nobody's going to tell you that. You may end up having testing of your entire workplace just so that we can test this one person.
Okay.
Yes,
So
these
you
are
throw out a net.
These are some of the ways that it's done. It's not necessarily that we're going to go to this particular person and say, yes, we need to test you for HIV because you're in contact with somebody. No,
right.
It's not usually done that way. So some of you may have been contacts and have been tested, and you would not have known that it was because you were a contact.
Okay, that's very interesting. So you're not going to go to the person and say, well, you were with Glenda, so that's why we're testing you today. No, that's not how it's done. Okay, I see we have another call. Let's see if we can just take this call. Caller, good morning.
Yes, good morning. It's me again. I mean, you're doing an excellent job by informing the people, and I think also a lot of times is sexual transmitted disease, and if it's not addressed on time and early, that's what breaks down the immune system, because there's not such thing as this. I mean, that's just my point, my views. There's something called HIV virus. It's the sexual transmitted disease that's not addressed early, and it takes over the immune system and breaks down your body. For a reason why I say that, I worked with someone, but she since then passed away because she's never took care of herself on the job and things that she eats. And she was dating a Jamaican brother on my job. And for years, and he was concerned. Our supervisor told him, well, go and take a test so that you'll feel better. And he took upon 3 tests, 3 different times. And all of them were negative. You know, and I remember talking to her when I heard she was sick. I told her, watch what you eat, because the food that you eat helps feeds the virus, you know. And you know, some people have their own way and they don't want to listen to no one, you know. So this is what happened, because we all are there to help each other. From my case now situation, I helped 2 individuals that suffer from even cervical fibroid tumor, and it was successful, and they had children. The little knowledge that I have. So we all are there to help each other. But the cleansing and detoxing the body and taking food that builds up your immune system will help eradicate any virus and bacteria from the body. Thank you. I'm listening.
Thank you, caller. All right. So we will take a break. And before I take that break, I wanted to give you all that chance to just leave us with your last words, because I know you all have another engagement and you have to leave us. So yes, Nurse and Clevencia, let our listeners know, you know, your parting words on this program this morning.
Okay, so we would like to invite everybody, once again, we'd like to invite everybody to come and get a test. People who do not know their status or are unsure of their status, please come and get tested on Friday, the 1st of December at the back of the church upstairs. Just come. We'll be there, we'll be waiting, and we'll be able to walk through your concerns for the week.
Yes, thank you so much, Trudy and Jolis, for inviting us on this program. It was a pleasure being here and sharing information. I just want to thank the last caller also, because he brought up an important point, that it's important to have a healthy lifestyle, diet, exercise with any type of disease that you have, any type of condition that you have. It's important to have a healthy lifestyle. And even for us who think that we are totally healthy, we also need to have a healthy lifestyle. So I just want to encourage everyone to continue to have a healthy lifestyle, healthy sexual lifestyle also, make good choices. Having a test does not mean that you are going to keep HIV positive. You have to know your status, but you also have to add to that those kind of behavioral changes that are going to keep you HIV negative. So we are available on World AIDS Day on Friday to do testing, and we welcome everyone who wants to get a test.
Okay.
Thank you so much.
Thank you so much, and thank you so much for joining us here on Health Vibes. We're going to take a quick break, and when we come back, I will continue the discussion, and we will hopefully Mr. Langdo will be back with us. Will be with us by the time we get back from the break. So we'll be right back.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. The one-stop shopping Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. The one-stop shopping Dominica, nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the
best family shopping experience. Who say health cannot have vibes? Well, Jolly's Pharmacy is proving you otherwise. With Health Vibes, every Wednesday morning on Q95 from 10 a.m. to 11:30. Health Vibes, education, information, and a bit of humor. And not forgetting lots of vibes. Hosted by Carlton Langdo with co-hosts Jacinta Fagan Defo and Trudy Kristen. Jolly's Pharmacy is bringing health and vibes together every Wednesday, so be sure to tune in. Health Vibes every Wednesday on Q95 from 10 a.m. to 11:30. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega, 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 Mega. Your one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place, happy place.
Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
I woke up this morning feeling real stink. I had the intentions to call in sick, but I end up in Jolly's Pharmacy. Great and down in the street, Jolly's fix up my immune system. Got me feeling fit and strong, now I'm ready to work and take on any mission. If you see me walking, Jolly's Pharmacy is number one, Jolly's walking. We cater for everyone, Jolly's walking. Boost up the immune system, Jolly's walking. Yeah. Yo, Dominica is the white father box. Whenever I'm in town and I'm feeling down, I head to Jolly's Pharmacy. They boost me up real quick. Jolly's Pharmacy, leading the way in healthcare.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place, happy place. Oh, JP Mega, 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 Mega. The one-stop shopping, Dominica, nigga, 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 nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place, happy place.
Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for a discount. Check us out at the Mega Store in Funkole, where there's lots of parking on Monday to Friday from 9 a.m. to 7 p.m. On Saturdays from 8 a.m. to 6 p.m. and on Sundays from 10 a.m. to 2 p.m. JP Mega, the best family shopping experience.
And we are back with you. Of course, this is Jolly's Health Vibes. This morning, we've been talking a bit about HIV and AIDS. Friday, the 1st of December, is recognized as World AIDS Day. And so typically awareness is really brought forth on HIV AIDS for this day. So we had with us in studio 2 ladies from the National HIV AIDS Response Program. They have had to leave. They had to leave a little early, but we had a good discussion on Health Vibes this morning about HIV, what it means, what a positive diagnosis means for someone, how there is treatment now in play that can allow someone to live a full life without developing AIDS. So being HIV positive does not need to mean that you are going to develop AIDS. At the point of AIDS, the disease AIDS, acquired immunodeficiency syndrome, AIDS, your immune system begins to lose its ability to fight off common infections. So very common infections can cause you a problem and can cause you to die. That's if someone has AIDS. But if someone has HIV, human immunodeficiency virus, they infected with the virus, but they are treated and the viral load, the amount of virus in the body remains low, then that person can live a productive life, a normal life, once they are under correct treatment. So the ladies at the National HIV AIDS Response Program have encouraged people to come out and get tested. They will be doing testing on World AIDS Day, which is on Friday, but they normally do testing and it is free. So you can go there to get your test done, to know your status and not be, living in doubt, living in fear. If you feel that you should get a test, of course you're sexually active, you have never had a test done before, then it's a good time to make that decision and to get your test done. I just want to let our listeners know of our phone numbers once again. If you want to continue with the discussion or make a comment or a contribution on the discussion that we have been having about HIV and AIDS, you can feel free to do so. Our numbers are once again 449-3095, 449-3096, 449-3097, and 616-4257. If you're calling from the overseas line, you want to reach us and you're overseas, the overseas line number is 305-432-9624. So of course, if you want to make a contribution, if you want to, add something to the discussion that we have been having here on Health Vibes about HIV and AIDS, the importance of testing, the importance of treatment, and the importance of ending the stigma and the discrimination against people who are HIV positive, then you can feel free to call any of our numbers and make your contribution on this platform. I still am here in studio, and Mr. Langdo has not joined me as yet, so I'm still holding down the fort here in the studio of Q95. And if Carlton does come through, of course he will share his views and his thoughts on this topic. But you can feel free to do so as well. I wanted to speak a little bit yesterday. Dominica was, I would say, shocked and taken aback by the very sad news of the death of a very, very, very popular, very well-known and kind, humble businessman. That's Mr. Ronald Astafan. And, everybody who heard the news and knew him was pretty devastated by his tragic loss. I wanted to just extend condolences to his family, to his friends, to all those who may be bereaved by his untimely passing, and to really, encourage people, encourage us as Dominicans to take a bit more heed and a bit more care as it relates to mental health. It came up in the discussion that we were having, I was just having with the ladies from the National HIV AIDS Response Program. But it's a discussion that we always have here on Health Vibes, the importance of mental health and the importance of understanding mental health issues and how devastating they can be, and how we can really help one another as it relates to that. So awareness is one thing, and then taking the steps to be helpful, to be careful with each other, to really reach out and understand certain mental health issues, particularly with people who maybe you feel could not possibly be impacted by a mental health issue. That is another thing. Sometimes we say this person is too happy or too smiley all the time or too comical to ever be feeling any sort of real mental health issue or concern, and that is definitely not true. So this is just an opportunity to really look at ourselves, how we reach out, how we deal with each other, and to understand that it is a very important aspect of our lives, our mental health, and that we should do our best to make sure that we preserve that as much as possible and look out for one another. So, just once again, I'd like to extend my condolences and that of the team of Jolly's Health Vibes to the family, friends, and those bereaved on the passing of Mr. Astafan yesterday. We have a caller. Let's take this call. Caller, good morning.
Hello, Julie.
Hi, good morning.
That is Christian.
Yes.
That's Teacher Lufa.
Hi, Teacher Lufa. How are you?
I'm good.
Okay.
Julie, I think one of the problems people who are this mental health, they keep the things to themselves and they don't dialogue with people. I think we have to emphasize that you have a problem, discuss it with somebody. If you feel that you might like your family and so on, but get some confidence. Or my partner Landu, I always come and talk with him anytime I have talk to somebody. Don't keep it inside. Because one day you will just happen to say the wrong thing. Thank you very much.
Okay, thank you for that contribution. That is also one aspect of this whole thing that's difficult sometimes because of how people feel they may be perceived, or once again the stigma, the discrimination that is associated with having certain mental health issues or concerns. Our society sometimes can be tough on people who may be going through certain challenges, and so that now causes people to kind of be hesitant and avoidant of speaking out. And that is the kind of dynamic that we really want to change. We want people to feel comfortable addressing their issues if they are mental health related, to not feel that it is taboo or there is some sort of judgment that would be placed on them for having a mental health concern, for suffering from depression, suffering with anxiety, suffering, some people with post-traumatic stress disorder, suffering from different phobias, different fears, unfounded fears. All these are examples of mental health concerns or issues that people experience. So the more we kind of change the dialogue and allow people to understand that it is okay, it is not some sort of indictment on you if you have a mental health issue. It is okay to come forward with it. It's okay to seek help for it. Then we can have a more accepting society, and we can have people more willing to come forth. So I think this is really a lesson, and we need to take heed to lessons. Anytime lessons are being taught, we need to take heed. The lines are going. Let me take this call. Caller, good morning.
I'm glad it's that call you took. Trudy, good morning to you.
Good
You
morning.
already one there?
Yes.
Yeah, as a matter of fact, I was in a long conversation, so I missed the start of the program, and I just got off the phone and I heard you. And what you're talking about is kind of what I was thinking of you and Carlton to introduce a program, because they're talking about lessons learned, I guess, from the incident with the man, right? Let me say something to you. Remember in a couple of conversations, I always talking about stress and constant stress.
Always.
And always. And how it affects people in terms of cortisol and adrenaline and all that. And I want to take another area still to do with the stresses and all the mental things and the distractions and how people are, and what's happening right on our little rock there. People are very distracted, and that is, to me, is by design. And people don't. Simeon spoke this morning, and he said a lot of things. Simeon Joseph, and he talked about paying attention. A lot of people don't pay attention because of all the distractions, and the distractions are there to create what exactly it is, distraction. And you cannot pay attention when you're distracted. And people don't see a lot of things. And there's something that's prevalent in our society to couple with that stress. You see the depression that we're speaking about? It's at different stages, but you know where it starts? when it becomes major depressive disorder. That has to do with disturbing all your neurotransmitters in your brain and your whole physiological system and mental system. I mean, it's deep. I'm not a doctor. I understand a lot of things. When I talk, it's because I understand. I do a lot of research. I like to read. I like to follow the top of the top in doctors in their specialties. And that is why I speak the way I speak. I live a certain way. I eat a certain way. And I'm telling you, this thing is something that, even though we're speaking about it there are a lot of people that hear and they don't understand. There's a lot of people, even though they understand and comprehend. You're hearing about composition and comprehension. A lot of people can even read and don't comprehend what they read. A lot of people can hear things and still don't comprehend what they hear. I remember as a young boy, my grand used to say, "Kute putan tan puko pon." And really and truly, it has to do with we always talk about education, and to me, I'm going to say it like I have it. Too many people don't even want to be educated because with all these distractions and these misplaced values and misplaced priorities, we are in a decadent society that I'm seeing people just falling apart, and you still have the people that's supposed to make a difference not paying attention to that. And that's going to be detrimental to a whole country, almost to a point where it's unsalvageable because of the level of decadence I see in every aspect of the society. And I'm saying, I want to give you kudos for what you're doing, for what Jolis is doing, for what Carlton is doing, to educate the people about themselves and their health, and all aspects of their health, from their head to their toe. So, not said for now, we just wanted to interject that, but that's a program that needs to be had about MDD, major depressive disorder. Have a good day.
Thank you, caller. So yes, we have and I remember us having shows with Dr. Nadia Wallace, where we discussed that. We've had different clinical psychologists on the show, like Shoyagi Grant Massicott. We've had this discussion about depression and about major depressive disorder as well. But it's something that needs to be continuously done. I agree. And as Mervyn was speaking, what also came up is sometimes we have the knowledge, we understand some of the mental health conditions that we may be discussing and we may be educating on, but our response to that is maybe what we are unsure of. So a lot of people may say, I noticed this about someone or my friend, my family member, whatever, but I don't really know how to approach it or how to deal with it. And so what someone might do with not knowing is to just kind of ignore. If you don't look, you don't see, you won't know. But I do know that is maybe one of the problems that we face, is not knowing how to deal with someone who is going through a mental health issue or is going through some sort of condition. We not being the professionals and not knowing what to do. So more discussion then has to be had, not just in being aware of mental health challenges, of the impact that they have, but of how we can respond or how we can be helpful. What can we do? So, that is the other aspect of health education that we maybe need to focus on a bit more. What is the response of us, the common people? We're not the psychiatrists or the psychologists, or the medical practitioners. So what can we do, for our friends, for our family? How do we direct them to get the best possible care or the best possible remedy for whatever it is that they may be facing as it relates to mental health. I did see that we had some people trying to call in, so you can feel free to try again. The line is open. We have just a few more minutes here on Health Vibes this morning. So if you were trying to get through and you were unsuccessful, you can try again as we wrap up today's program. But of course, it's always something that we on Health Vibes will continue to bring forward. It's the importance of mental health and how to deal with mental health issues. Let me take this call. Caller, good morning.
Yeah, morning.
Good morning.
Yesterday you said that the people should not afraid to come and see what they have. But at the same time, you must also tell the public you must not harass people who suffer with AIDS. Because that's the reason why they're afraid. It's because people are always skeptical when they have that sickness. So you must always go in the public too. It will both sides.
Hello?
Yeah?
Yeah, repeat. What is the last thing that you said?
I say you saying to the people, do not afraid to tell the people to tell them your problem, you know what you have. But you always have to tell the public too. When somebody saw this part of the disease, they must actually antagonize.
Okay. Okay. I got you. Thank you, caller. Yes. So back on the topic of HIV/AIDS and disclosing and that type of thing. And I guess the same thing the caller just mentioned for that, it can also apply to mental health challenges as well. And we did mention that when you know or there's a rumor or whatever it is about someone's health condition, be it HIV/AIDS, which is what we were discussing initially on the show, or now we have kind of transitioned into mental health and mental health issues. Whatever it is, you have to, as human beings, as the public, extend empathy and not extend judgment and not, cause the person to be discriminated against by your actions and by your words. So that is a very, very pertinent message. Let me take this call. Caller, good morning.
Yes, good morning, Trudy. How you doing?
Good morning. I'm good.
Good. Let me pick up my brother Mervin. I like what you're going to tell you, Mervin. I like that. But Trudy, you said something a while ago that I want to make a comment on how the toughness of our society seems to be sometimes on certain issues and what we're dealing with mentally on the subject we're dealing with. I really have a different take on it, Trudy. It won't be long. What I feel is a lot of our toughness and our outward expression on certain issues like mental issues, the stress of the society and what you're dealing with this morning, or illnesses. A lot of these people are cast aside or looked down upon because of certain illnesses. Because the society is not being tough on them, but people are just ignorant and not informed of certain illnesses and mental issues. So the way we deal with it is like this kind of toughness or to cast you aside. And this is where the problem is. If we are a society that is more informed, more compassionate, more knowledgeable of certain things, and like Mervyn said, when you be able to read, understand, and comprehend, you take things like that in a different light. You see it differently. That's all I want to say. Thank you.
Mm-hmm. Thank you, caller. Thank you for that. Definitely. Definitely. That is definitely one of the things that we need to focus on. I have another caller. Let me take this call. Caller, good morning.
Hello, good morning.
Hi, good morning.
Morning. Truly, we are so insensitive to each other's needs.
Mm-hmm.
We people might think it's no fault of their own. And when people go, they laugh at them, say, say, chopping, say, yashi. And they say so many things that are not nice.
Mm-hmm.
all of us can be mental, all of us can get AIDS, we never know. But people look down on people, I don't know why. It is an illness, and we should be helping the people, praying for them, instead of ridiculing them.
Correct.
We should be sensitive to each other's needs, because no one of us know where we will end. That's what I have to say.
Correct. I agree. Thank you, caller. I definitely agree. And that is why, I mean, I speak on different health issues and different health concerns. Initially, I did a lot of advocacy work on female reproductive health issues. And I always speak about empathy. It's one of my words that I use a lot. And it's because I feel that as a society, we lack a lot of empathy. We lack empathy as it relates to health and to health issues, and that is broad. It is, from physical health, mental health. The empathy that we need to extend is often not there. So I really want to end on that note to just encourage us to as the last caller just said, to think that you could be in a situation very similar at any time. I mean, as it relates to health, it knows nobody's exempt from suffering from ill health at any time. It can be any one of us. It can be mental health, it can be physical health, it can be an infectious disease, a non-infectious or chronic disease, so we are not exempt. So empathy. I'll take this last call. We need to wrap up the program. Caller, good morning.
Hi, good morning. Trudy?
Yes.
Yeah, you, after sympathizing with the family, you started speaking of mental health issues, right? To me, that wasn't going down good, because it's making people think that the person, no diagnosis was done on the person that is dead, and talking about a mental health issue, giving people the impression that the person was suffering from mental health. So to me, I didn't find that was going down good at all. Have a blessed day. Bye-bye.
Okay, thank you. Thank you, caller. I continue the discussion in that light because of a lot of the discussion that was going on, and how we went on from the HIV/AIDS discussion about mental health and its importance. So that is where this discussion kind of came in. But I take your point, caller, on that. It wasn't the intention to, sort of castigate anybody, but it's just a discussion that has been floating around, and that we really, always talk about on Health Vibes, is the importance of monitoring and understanding mental health and its importance. So that is it. It's 11:35 a.m. and we are at the end of our time. So I want to just extend, of course, wishes for a good week to everyone. We will be back on Health Vibes next week, Wednesday, God willing. I will not be on the program, but Mr. Lando should be next week. So look out next week for another episode of Health Vibes. I do wish all our listeners a very good week, and a week that is healthy, a week that is, focused on health and well-being. So have a good week, and goodbye.
Oh, and if they say convenience could make a big difference, then you can trust me. I know just where you should be. And that is JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun with your daughter or with your son. We cater to everyone. What a happy place. Oh, JP Mega. Your one-stop shopping, Dominica, nigga. You could be shopping and having fun. Bring papa and mama along. We cater to everyone. What a happy place. Oh, what a happy place. Purchase 6 or more of any item and you automatically qualify for discounts. Check us out at the Mega Store in Funkole, where there's lots of parking.